Good morning. Thank you for coming. I would like to introduce you all to our Craft HITRUST team. In order to become certified as a HITRUST advisor, each member was required to have at least 2 years of experience in both healthcare and information security roles. They then completed 6 to 10 hours of self-guided study and approximately 20 hours of face-to-face training in preparation for a 2-hour exam. They also participate in ongoing annual training and recertification every 2 years. Gina Pruitt is the leader of our firm HITRUST team. She's a member in charge of risk assurance and advisory services with Craft CPAs and has more than 30 years of experience. Scott Nally is a senior manager in our risk assurance and advisory services practice at Craft with more than 10 years of experience in both public accounting and the private sector. Tanya Tepsongse is a senior consultant in the risk assurance and advisory services practice with Craft CPAs. She also has nearly 10 years of experience in this role. To begin, I will pose the first question to Gina. Please give us a general idea or comparison of HIPAA, HITECH, and HITRUST.
Everybody has heard of HIPAA. The two main things that HIPAA was enacted for, one, which a lot of people have probably forgotten about, but originally it was to protect workers from losing insurance if they lost their job or changed jobs. The second is the one that we're most familiar with, and that is to protect the privacy and security of PHI. Just in most simple terms. So HITECH, the difference in HITECH and HIPAA is that HITECH was enacted in 2009. There you go. It was enacted in 2009 as part of the American Recovery and Reinvestment Act. And it was an extension of HIPAA, and it was really, if you all remember, some of you aren't old enough yet, but if you remember back to when HIPAA was enacted, it didn't carry much weight. There was not a lot of enforcement, and it was there, and people knew about it, and doctors' offices tried to put the thing up on the wall, and you started seeing when you walked into the doctor's office just the form that you read and were supposed to sign. But as far as the actual institution of compliance, it wasn't really enforced until HITECH came along. So HITECH actually instituted steeper penalties. It also increased stipulations for business associates. We'll talk about those a little bit later and what their responsibilities are. And then it added new breach requirements. HITRUST is a fairly new topic. I don't know, how many of you have heard of HITRUST? A few? Okay. So HITRUST, unlike HIPAA and HITECH, it's not a law. It's a certifiable security framework. It's called the Common Security Framework, or CSF for short. And it was originally designed for healthcare entities, although really now any industry can use it. It's based on several different security frameworks and several other authoritative literature pieces. Some of the frameworks include NIST, COBIT, HIPAA, of course, PCI DSS, and ISO. Specifically, it was built around ISO 27001. And from the standpoint of it being its own standalone framework, it does, if you had a Gantt chart, you'd have the big circle and then all these other pieces would overlap into it. It doesn't cover all of those other areas, but it significantly addresses several of those other areas. So you couldn't say, I've done HITRUST and I'm fully covered for HIPAA. There will be some things that, you'll still have to do to be HIPAA compliant. Even if you were HIPAA compliant, there'll be several more things you'd have to do to be HITRUST compliant.
Gina, what was the intent of the HITECH Act and what incentives came out of it?
Yeah, so the HITECH Act really, one, was to strengthen HIPAA and the compliance for HIPAA specifically, but it was also to encourage the use of electronic health record systems. And HHS has some very specific approved EHR systems that they want you to use if you implement a new system. It also provided some monetary incentives. So if you're in a physician practice, you've probably been trying to implement meaningful use, which is how are you meaningfully using technology in an EHR to provide better security and privacy for your patient data. And that in itself has certain, monetary procedures based on the stage of meaningful use that you're in.
Okay, thank you. Tanya, what is the difference between privacy and security?
The words privacy and security are often used interchangeably in relation to data, but they're really separate concepts, and we need to think of them as more complementary to one another. We need security controls in order to keep data private. In relation to HIPAA, the privacy rule basically establishes individuals' rights in relation to their own health information, including conditions under which PHI can be shared with other parties or used and disclosed in marketing or research purposes, either with or without the patient's consent. So basically it tells us who is allowed to access patient records, when they're allowed to access them, and whether or not you need the patient's permission to do so. Whereas security establishes guidelines around the operational and technical controls that we need to have in place in order to ensure the privacy of information. It kind of sets the standards for who should have access to PHI and how we're going to ensure that they do have it. It's also important to note that the privacy rule covers PHI in all forms, so that includes electronic, written, or paper records, and oral PHI. So when you go to the doctor's office and you have to sign the form that says, if we call you, can we leave a message, and what can we leave on the message, that you have to fill that out because it's part of the privacy rule. And the security rule only covers electronic health records. So I think that's something a lot of people don't realize. But so that's why the physical security of PHI is actually covered under the privacy rule, because it also encompasses the physical security of paper records.
Thank you. Gina, what is required to be in the privacy notice?
So in the privacy notice, the purpose of the privacy notice is to let the patient know what their health information is being used for, and if it's being shared, and who it's being shared with. So it has to include that. It has to include their privacy rights. They also have to obtain permission from the patient for any other use than what they say they're going to use it for. Curiously enough, you go into the doctor's office and they give you that to read, and then they want you to sign it. You don't have to sign it. That doesn't preclude them from being able to use it. They just have to have you read it. And they have to make a note that you didn't sign it, but that doesn't mean that you can't go ahead and use it. But if you're going to use it for any other reason than what you've noted in your privacy notice, you do have to let them know that and get their written permission for that use. You also have to let them know what your organization's responsibilities are to protect their health information. You have to be accountable for disclosure for 6 years. So if they were to come back and ask you, can you show me how you used or shared my data, you have to be able to show them a trail of that for the past 6 years. As well as how do they contact your organization? Who's the best contact with regard to HIPAA if they have an issue or they think they have an issue? And then how do they make a complaint? Not only with your office, but how do they make a complaint with the OCR or the HHS? As we all know, OCR now has fairly easy system to do that online. You can just Google it, and there's a link, and you click the link, and you can do it all online now. So they've made it fairly easy to file a complaint. Also, if you have a website, you have to post the privacy notice on your website.
Scott, what are the typical controls that should be in place in order to be HIPAA compliant?
All right, so the first one is, I'll say it's the easiest. I mean, it takes time to develop policies and procedures, but as you all know, the HIPAA requirements aren't real prescriptive. So you have to decide how you're going to implement those in your organization and what controls you have to have in place to be able to meet those requirements. So it's very important to document that in policies and procedures that you can provide to your employees so everyone is informed and understand what their roles and responsibilities are. Along with that, you need to provide HIPAA and security awareness training. So the training that you provide should include those policies and procedures that you've developed. And you want to make sure that as part of that training, the right folks are receiving the right information. So there's going to be elements of those documented policies and procedures that certain individuals are going to need to know more about than others. For example, if you have things documented about incident response, maybe with a security incident, that type of thing, it's good for everybody in your organization to know what that process looks like. But obviously your IT folks that are responsible for responding to that need to have additional education on exactly what to do, how do you report information, who does it need to be reported to, what are the time frames that information needs to be reported, whether it be to the patient, another party, a third party, or just internal reporting, those types of things. And people are going to be your weakest link. So your people, your employees are the ones that have access to this information that you need to keep protected. So obviously they need to be educated on what they need to be doing. And they're going to be the ones that ultimately disclose information, whether it be through social media. I think we've heard issues where people, maybe nurses, have posted things on Facebook about a particular patient or something like that. Obviously, that's not appropriate, and they've probably received training as such, but even though you tell them repeatedly, they're still going to do it. You know, if you have a celebrity in the hospital or something like that, they're likely to leak that information. You know, they need to be trained on how to properly secure a terminal. We have a variety of computers within patient rooms and that type of thing, and you need to make sure that those terminals are locked and have strong passwords on them. Your employees are the ones that are going to be clicking on links that could be that could cause a breach, that could allow a hacker or attacker into the organization. A quick example that I've seen personally is I worked at Vanderbilt for a while, and I repeatedly would get these faxes trying to come through my office phone. And after months of having to delete everything in my mailbox, because over the weekend it would just fill up the mailbox, I finally forwarded my phone to a fax machine to find out what was coming through. Of course, it was patient referrals that were coming through to my phone. Fortunately, I was an internal employee, so I don't think that it was a breach scenario, but I did. You know, I don't think it was a violation of HIPAA, but I did inform the area that they had the wrong phone number of whoever they were trying to refer these patients to. And I've heard of situations where people will program the wrong phone number into a fax machine and just repeatedly try to send a referral or, you know, pharmacy request or something to that wrong phone number. So those are areas that employees need to be aware of, and we have to educate them on. Along with that, applying sanctions. So if you do have an employee that violates your policy or something related to HIPAA, you need to make sure that you counsel that employee and that whatever steps you take are appropriate, because what you want to make sure that this is important and that everyone sees it as important. Of course, you want to assign a privacy officer and a security official responsible for developing those policies and procedures and helping make sure that they comply with the requirements of HIPAA and also that they are in place and effective on an ongoing basis.
Okay, Tanya, what does addressable mean for HIPAA requirements?
So the HIPAA security rule indicates that safeguards is either addressable or required. So all covered entities and business associates must comply with all the required safeguards, but don't be fooled that addressable means optional, because it does not. Addressable safeguards for these, the organizations can do an assessment to determine if the safeguard is reasonable and appropriate for their environment. And implement the safeguard as prescribed in the guidance, or they can implement compensating controls. If it's not reasonable, like if it's too expensive to implement a certain type of technology, a security technology for a smaller organization, they can implement compensating controls for that, or they could even determine that the safeguard, addressable safeguard, is not applicable to the organization. But for whatever choice they make, the organization must make sure that they document either the safeguard and how it's implemented, or why they chose not to implement that safeguard. And if you choose not to implement the safeguard, you probably need to be pretty detailed about how you came to that resolution and what kind of risk and what kind of analysis you did to determine that it wasn't applicable, so that if you have an assessment or an audit of your security and privacy controls, you have documentation to show that you at least thought about it and considered whether or not it was needed to be implemented.
Gina, what if you're a third party? What is your responsibility for HIPAA?
So third parties have the same responsibility as a physician practice or a hospital for the security, even if they're not a healthcare entity. If you're using them for some reason, whether it's to do backups for you or to manage your network or set up the computer system, whatever it might be, they are still legally bound to keep PHI protected. And so that's why you have business associates agreements, and the business associates agreement should be specific to those types of situations. So I know that we all have standard business associate agreements, but you do need to customize them a bit, and it really depends on what type of third party they are.
Hey, Scott, who should have a business associate agreement?
So any third party to a covered entity that uses PHI in the performance of the service that they're providing to your organization. Some examples might include a computer software or hardware vendor. So if you have if those vendors have access to your data, oftentimes you're allowing those folks to do maintenance either on the hardware or help install patches and that type of thing on the software. If they can come in contact with that protected information, you should have a business associate agreement with them. We're working with a variety of data analytics companies, and so are you providing your information to a third party to help you analyze maybe patient outcomes or even doing patient surveys? What information are you providing to them to be able to do those surveys? And if it's protected information, then you should have a business associate agreement with those folks. Obviously, medical transcription and third-party billers, they often have access to medical information, so you want to get one with those folks. Attorneys, I don't know if you're working with an attorney to help you in some sort of lawsuit, but oftentimes, depending on the circumstances of the case, they may have access to PHI. Your accountant and auditors, so those of us sitting up here at the front of the room, depending on the type of work that that consultant is doing for you, they might have access to that PHI. We often sign business associate agreements with folks, even if we don't intend to come in contact with the PHI. It's just a matter of protecting everyone in those circumstances. You know, we do get access to a whole lot of information, and sometimes going into an arrangement, you don't necessarily know for sure what information you're going to have access to. And then your shredding and data destruction companies. Obviously, the shredding companies, I'm assuming that you have locked shred boxes or something that you have a third party come pick up and shred for you. You want to make sure that those individuals have a BAA. I assume that you're putting PHI or potentially protected information in those shred bins, and you want to make sure that that information is protected, along with the data destruction. So if you're using a third party to destroy computers or servers or any of those electronic devices that might have PHI, it would apply there as well. Generally, a BAA is not going to be required if you're providing information to another covered entity. So an example there would be your physician referrals. You know, that's not a third party providing the service for your organization. They already have to be HIPAA compliant. However, there might be examples where you're working with someone who typically wouldn't need a BAA. However, they also provide a third-party service that a BAA would be required. So you have to look at each circumstance individually and decide if it's appropriate or not or necessary.
The other thing I would say about BAAs while we're talking about third parties is that a lot of third parties, and Scott mentioned data analytics companies, a lot of healthcare companies now want someone to do those data analytics for them so you can see trends and look at, you know, what types of things it appears are coming down the pike based on those trends. So those types of third parties that are dealing with data, that are helping you with systems, maybe supporting a network, maybe your EHR, you're using a software as a service. If you have those types of third parties, they need to have the SOC, the SOC, what's called a system and organization control attestation engagement. It used to be the SAS 70. Then it was called Service Organization Controls. It just changed in 2017 to System and Organization Controls. But they need to have that, and that would be something you would ask for, that they give you every year in that BAA, because you're going to need to manage them. They're vendors, and you want to manage how they're controlling and securing the privacy of the data they're using, because not only is their responsibility, but ultimately it's your responsibility. Whatever happens with that data, if they had a breach, it's going to come back on you. That's what happened at Target, for instance. Just in general, they had a third party, and the third party got breached and got into the system, Target system. So that can happen anywhere if you are letting a third party either access your networks, support your networks. If they're supporting your networks, or you have software service through them, they have some type of administrator access. They can get to anything and do a lot of different things. So accidents happen. I would just say get those reports, and the things you look for is do they have a qualified opinion or an unqualified opinion? You want it to be unqualified, meaning there weren't enough exceptions to say that their controls are not really working. They can still have exceptions if it's an unqualified opinion, and you can look for those. There's usually a table that'll show you no exceptions or exceptions noted, and it'll tell you what the exceptions are, and a lot of times they'll tell you in the back of the report what they did or what they're doing to fix it. But that will give you pressure on that third party if they have those types of issues that might affect your patient data, then you can have a little conversation with them.
Thank you. Tanya, what are some of the typical issues you see when doing a HIPAA readiness assessment?
So one of the biggest things, and we've already touched on it quite a few times, is documentation. So one of the most common things we see is that a company will have all the elements that they need in their privacy notice because they've spent a lot of time on that, because that's something that they have to give to their patients or have to have on their website. But they may not have policies and procedures on the back end to tell their employees how they're supposed to carry out those things that they say they're going to do in the privacy notice. And HIPAA guidance is kind of a one-size-fits-all, and it can be fairly vague and open to interpretation, so it doesn't really give you a lot of details about the elements that you're supposed to have in your policies and procedures, but it is really prescriptive about what should be in the privacy notice. So I think we see, a lot of times where the organizations have a really good privacy notice, but then we ask, okay, well, if somebody asks you for an accounting of disclosures of their health information, how are you going to do that? And they don't have a policy or procedure documented to tell their employees how to pull that information. Then a few other things that we see are related to proper encryption. Most companies do a good job of encrypting servers and laptops or workstations, but one of the things that you have to make sure of to be HIPAA compliant is that all the data is encrypted in transit and at rest. So that means your emails, removable media, backups, things like that. So what we'll see a lot of times is that encryption is good on servers and workstations, and all the laptops are encrypted, but they may not have encrypted email, or they may not have their USB ports on their computers locked down to only permit encrypted thumb drives, and even the backup media. So if a lot of companies don't use actual tapes anymore, but if you do, you need to make sure those tapes are encrypted. Or if you outsource your backups to a third party, you need to ensure that they have encryption, and that kind of goes back to ties in with making sure they have a BAA and have a SOC report, and you want to make sure that you're reviewing that SOC report to make sure that they are encrypting backups. As far as email goes, we do have a client that does a little trick with their email to make sure that they're secured. Their email system supports the function if you put the word secure in brackets anywhere in the subject or the body of the email, it'll automatically encrypt the email, and I think a lot of email systems have that function. So they all put in their signature line that automatically populates on their on every email, they put the word secure in brackets in white text, so that you can't see it, but it automatically comes up every time they send a new email, and it secures their email. So that's a little trick that I've seen with a client that you might want to implement when you get back to your offices. Another thing that we see is a common issue is patches and security updates. And this is a common issue that we see in all engagements, not just HIPAA or HITRUST, that, you know, patches don't get implemented across the organization. You know, there may be a file open and updates don't happen or things like that. But if a vulnerability exists in your network, a hacker is going to find it. And health records are worth about 10 times more on the black market than a credit card. So if you're a healthcare organization and you have vulnerabilities, you're just a sitting duck to get a breach, because their hackers are making it a priority to try to find places where they can get health records versus credit cards or social security numbers, because they're worth a lot more. If you get 1 million health records and you can sell them for, you know, $100 versus if you get 1 million credit card numbers and you can sell them for $1, what would you go for? So you want to make sure that you have patches and security updates on all your systems. I think I read in 2017 one of the largest breaches, I think it was in an Alaskan health system, was because they didn't have proper patches on their servers, and tens of thousands of records got stolen because of that. So.
And one thing I'll add about patches, we see clients that have a variety of tools that let them know that a device has been updated or that the security patch has been delivered. And what we've seen in certain cases is that the patch was delivered to the machine, however, it was never installed. And so those of you that are IT auditors or maybe want to dig into this a little bit, you always want to make sure that you understand what the tool you're using is reporting back to you. So if it's just reporting that it was delivered, you don't really have any assurance that it was actually installed. And so when we do our testing, we just randomly go to computers and just see if that device is updated or not. We don't rely necessarily on those tools. I mean, we'll look at the tools, see what it's reporting, just to gain additional comfort, but that is an area where people think that they're covered, but sometimes they're not.
It's the same thing for antivirus.
Mm-hmm.
I would put that in the same vein, because most of you don't even know that your antivirus is being updated. It's usually set to update when you're not there at night, and it's an automatic process. And because it's automatic, people forget about it. Well, when we go and test workstations or laptops, we often find that they are not current on their antivirus, and it gets hung up somewhere on certain machines. We don't know why, or sometimes maybe you leave and you turn off your machine. And if you turn off your machine, you know, hopefully it's going to pick it back up in the morning, but if you don't, you know, if you turn it off and then turn it back on in the morning and you don't see that process running, it's probably not. You know, it's going to keep you from doing things because you're going to have to let it finish running. If you don't see that happening when you turn your machine off at night and come back the next day and turn it on, then probably it didn't run for that particular night. So there's a lot of different instances where the IT people might not even know that because these systems get hung up periodically.
Yeah, and I think conversely, a lot of times the patches, the system needs to restart to actually install the patch, even if it's been pushed out through an SCCM or some other kind of tool. And like the terminals in patient rooms that the nurses wheel in and out, those stay on all the time, so they may not restart those and get those patches updated in there. So if the machine's not being forced to restart, you may go several days or weeks even without the updates being installed.
Well, Gina, what is the best thing a healthcare entity can do to protect patient data and minimize fines?
So we thought this was worth saying a second time. Encryption. Encryption. I think you have to hear it 10 times. How many more times do I need to say it? The HITECH requirements actually specify the type and standard of encryption that you need to use. But what we recommend is just to be consistent across the board and use at least 256-bit encryption. You can look that up if you want to know more about the standard. Now, if you go and Google it, it's going to tell you, oh, for data at rest, here's what the standard is, and it's NIST 800-something. For data in transit, it's FIPS, blah, blah, blah. That is way too much work for your IT people. If you just make it consistent, everything you do, make it 256 or higher. I mean, you can go to 516, but it's in increments. It's 32, 64, blah, blah, blah. Goes on doubling itself, but 256 is pretty much the gold standard right now. That's in both the healthcare and financial industries. That's what's being used. I'm sure it'll increase with more and more hacking going on, but 256 is pretty much what you need to apply, and it's not a hard thing to do, and it's not costly. To be honest with you, it's not that costly. It's not near as costly as what it would be to get the fines. And so if you have encryption and you have it on your email, your laptops, data and at rest, data in transit, on your network backups, that's where you need to, everywhere you need to have it. Your flash drive, all those places where data might be, you need to document that, make sure that it's working, and then if you do have a breach, that's the first thing you say, everything was encrypted. Yes, somebody lost that laptop when they were traveling. It's encrypted. So when that happens, it's going to either reduce your fines to basically nothing, or it's going to significantly decrease any fines that you might get. Fines are based on how many transactions or the volume of information that is on a particular piece of software or hardware, or that you've lost or that was breached. So when they can determine that, they'll calculate it based on that. But if that was encrypted, then none of the records can be opened, right? So encryption is the most important thing you can do.
If I can add something to the encryption that Gina was just talking about.
Or what count are we up to now?
At least 10.
So recently we were working with a client and we found that they had administrative privileges on their laptops, and I'm not sure if this is exactly the reason why, but they had turned off in some way the encryption on their computer. And so that's something that you need to be aware of, that your IT group, how are they setting up the computer? Number one, you got to make sure that they don't just say that it's encrypted, but somehow that it's confirmed that it is. And then you want to prevent your users of that machine from being able to turn off the encryption or other settings that you have there to protect that information.
So we need to be encrypted. Changing gears a little bit, Scott, can you tell us a little bit about HITRUST?
Yeah, so the question that I have for the group is, how many of you work in an organization that is constantly getting vendor assessment requests, where you have to respond, what does your security environment look like, and that type of thing? Are y'all dealing with those things? I mean, your organization might be, but maybe not you all specifically. Well, HITRUST was developed by a group of primarily healthcare individuals that were tired of responding to these vendor assessment requests. So what they did is they developed a framework that someone could get certified to help organizations respond one time. So if you go through the whole HITRUST process, you're responding to a lot of questions that are accumulation of a lot of different frameworks. So you respond one time to these questions, and what you're hoping for is at the end of that, when you have a third party come ask you, you need to complete these vendor assessments, you can just say, we're HITRUST certified, here's our report. That should satisfy all of your questions. There might be some third parties out there that don't accept that. I would be kind of surprised, especially in the healthcare industry. However, that's the goal. They wanted to put something out there that was easy enough for an organization to follow and to get certified against to be able to respond to all of those third parties. So the Health Information Trust Alliance, which is HITRUST, was founded in 2007, primarily by payers, hospitals, and other organizations in the healthcare industry. HITRUST is actually a not-for-profit entity. They collaborated with a variety of technology and information security leaders to develop this framework, and as Gina mentioned, it's a pretty comprehensive framework that includes a lot of different security frameworks that are available out there. It's primarily used by the healthcare industry currently. However, the principles apply to any organization, and I do think over time you'll see more and more organizations outside the healthcare industry to start to adopt HITRUST. So it's a certifiable framework, like I mentioned. What they do is it's very prescriptive. So we mentioned that HIPAA isn't real prescriptive. There's guidelines you have to follow. You have to decide how you're going to implement that yourself. However, HITRUST does some of that work for you, and what they have developed is very prescriptive requirements that you essentially have to follow in order to be certified by HITRUST. An example of that might be the 256 encryption, just to say that one more time. So, of course, HITRUST is going to have a requirement in there that your data is encrypted and that it meets the 256 encryption requirement. And so that's something that they're taking the HIPAA requirements, laying it out for you so that if you can respond, yes, we encrypt everything at 256, you meet the HITRUST requirement, and ultimately you meet the HIPAA requirement.
Okay. Gina?
One other thing.
Oh, sorry.
So,
sorry, go ahead.
That's fine. So HITRUST, what they've done is they've developed a GRC, so a governance, risk management, and compliance tool, where you answer a variety of questions based on the size of your organization, how many beds you have, how many transactions you process annually, revenues, those types of things. So you have to answer a variety of these questions that they utilize to determine which of the HITRUST requirements will apply to you. You also answer questions about the compliance environment that you work in. So certain states have certain requirements, so you answer which state you're in. Do you accept Medicare payments, and a variety of those things, with the intent being that they're going to try to pull in all of those regulatory requirements that you have to follow. So they try to include all of that in there. But so they have this tool. You answer the questions, and ultimately you can enter in what your controls are to meet all of the requirements that HITRUST has laid out for you. In addition, that tool is what's used for you to go through the certification process, which we'll talk about a little bit more. But basically, you can submit information to your third-party assessor in HITRUST through that tool.
So third-party assessors are people like us. HITRUST has put this in place, and they require a third party to put the information into that tool, send it to them for their validation and review. We're actually assessing your controls as to how they meet the HITRUST requirements, and we're documenting that in this GRC tool, and then they're assessing it. So you really need to work with an assessor to do that. And HITRUST is really it's a dynamic process and set of requirements, because as you all know, with cybersecurity and all the things going on right now, they have to be changing all the time, adding new controls, revising ones they have, and so for us, we have to keep up with it somehow. And the way we decided to do that, at first they force us to have at least 5 people who are certified in it. That we go to their training, and then you have to recertify. So in between, like I just did my refresher course, you have to do that annually. In between, every 3rd year, you have to go again and sit in a class for 3 days. But we staggered. We have 7 people, 6 or 7 people, and we've staggered the time of year that those people have to do their training, because you'll get something different. Every time somebody does either their refresher or their on-site training, you get something new. Yes?
For Gina or Scott. So first of all, thank you for explaining the difference, because I always just kind of lumped it in with HIPAA, and I was like, you know what, we're probably okay. So this is the first time you've done a great job of differentiating it. So I'm reading your paper, and it says it's not quick nor easy. So can you just give us a ballpark of how much time is it going to take for an organization to do it, and then how much is it going to cost us on an annual basis to stay compliant?
I'm going to cover that in the last,
Okay.
at the very end.
Okay.
Stick with us, unless you have to leave. Then I'll give you my business card and we can talk about it. So I think the next question is actually mine, right? Who's requiring HITRUST certification? Well, right now, it's mostly the large payer organizations. So your Cignas, Blue Cross Blue Shield, Humana, Aetna, et cetera, and they're requiring third parties that they work with to do this in their contracts. Now, I know that most physicians have a contract, right? You want to get paid by them, so the question is going to be later on. I'll answer it, whether physicians will have to implement this. So we'll talk about that in a little while. But from the standpoint of requiring HITRUST certification, it's those large payer organizations right now. We do expect that to expand because of what the tool documents. It's just a fairly all-encompassing, and because it's so much more comprehensive than, say, a HIPAA risk analysis.
Scott, what are the types of companies that are getting HITRUST certified?
So primarily what we're seeing, playing off of what Gina just said about the payers requiring their third parties to get certified, primarily what we're seeing is those business associates. So essentially those same folks that I mentioned earlier, your data analytics companies, your EHRs, those types of companies are the ones that are having to get certified to be able to meet the requirements of their client, which oftentimes is the payer or a hospital. You know, a lot of folks put information out into the cloud, so you have to think, as your cloud provider, are they HITRUST certified? Are they HIPAA compliant? So that's really what we're seeing. Those third parties that are hosting your information or have your information, and they want to, you all as an organization or the payer want to make sure that that information is well protected.
Another point on that is, do you know that third parties actually use third parties?
Yeah.
Some of our third parties use AWS or Microsoft Azure, for instance, and other third parties as well. So those third parties to the third parties also need to be compliant with HIPAA and usually HITRUST.
Our web needs to be covered. What are some of the requirements of HITRUST?
Many of the requirements for HITRUST are similar to what you would expect to be HIPAA compliant. But as we've mentioned, HITRUST requirements are much more prescriptive and extensive than what HIPAA outlines for us. As Scott mentioned, HITRUST has a tool that you implement or that you input a lot of your data about your company and where you do business, and how many employees you have and how many records you process every year. And when you input all that information, the tool basically spits out a framework of what controls you need to have implemented and at what levels you need to have them implemented. So based on the complexity and the maturity of your organization and your that you could have to comply with certain levels of implementation. There's like level 1, 2, and 3, and they kind of layer on top of each other. So the requirements obviously are much more detailed and tell you exactly in a policy what elements do you need to have, and some of the requirements are this long, and you have to kind of go through and figure out what you need to have in there. But the HITRUST has a scoring model called PRISMA, so that stands for Program Review of Information Management Assistance, and this uses 5 levels of to help organizations determine the maturity of their program. So those include policy, procedures, implementation, measured, and managed. So for each of these 5 things, for every specification, you have to look at, for a certain specification, do you have a policy? Do you have written procedures? And then how is it implemented? So if you have a policy and procedure, are people actually performing the controls as they're written in the policies and procedures? Are you measuring those? Are you doing assessments or monitoring those controls being performed? And then if there are any issues, are you managing the remediation plans on those issues? And then on top of that, you have to determine whether, for each of these 5 levels, if you're compliant, if you're somewhat compliant, if you're partially compliant. So there's 5 levels or a 5-point scale to grade each of the 5 levels. So as you can see, it's very complex, and even getting to the point of determining what controls you need to have in place, and what you're going to need to be compliant with HITRUST. As far as specific requirements, there are some slightly strange requirements that are included in HITRUST that you wouldn't typically see in a HIPAA assessment or even a SOC or SOX or any of those types of things that I thought were just kind of odd. So I wanted to mention those. One of the things is that your internal system clocks all need to be synchronized, and that is actually a requirement in HITRUST. And I think this is because we have to be able to do forensic investigation if there's a breach, and so you want to have chronological order of events across all systems if you need to investigate, how somebody accessed information and when they did it. And then another thing that's a requirement that you don't typically see, but it's good practice, is that all your equipment needs to be under a manufacturer's warranty or a service agreement, which could be a little pricey, I guess, for larger organizations. If you have a hardware life cycle of 3 to 5 years, well, you have to make sure that most laptops don't come with a 5-year manufacturer's warranty, so you have to make sure that you're covering your servers and your network equipment and things like that for the duration of their life. So as you can see, the HITRUST requirements are a lot more detailed and extensive than HIPAA or any other compliance framework. So organizations that think that they're HIPAA compliant and think that when they go down the path of HITRUST and trying to get certified that it's going to be a cakewalk, they're going to be in for a little bit of a surprise when they actually start digging in and trying to figure out what they need to do to be HITRUST certified.
Are there different phases or levels of HITRUST, Scott?
Yes, and what I want to start with is kind of the level part of that question, and I think it goes in with what Tanya was just talking about and maybe helps answer your question a little bit. So I think I might get these numbers off just slightly, but the bare minimum, if you're the smallest organization, not very complex, don't have a lot of regulatory requirements, I think the bare minimum number of requirements that HITRUST has is 159, somewhere.
It's 104 now.
Oh, 104? Okay.
Mm-hmm.
So 104. However, each one of those requirements has many elements to it. So some of those, like Tanya said, can be very lengthy, maybe 15, 20 requirements within the one requirement. To make that a little bit more complex, as your organization gets larger, the number of those requirements increase, but also how in-depth you have to be to comply with those increases. So Tanya mentioned the 3 different levels. Just a quick example that I pulled together to try to explain what those levels might look like. One is that all organizations are going to be required to have an information security management program. That's baseline. Everybody has to have it. It documents what your security policies and procedures are. That's pretty standard. You should kind of have it depending on, every organization should already have it. A larger organization would have to have in place a plan, do, check, act cycle for that information security management program, meaning you should constantly update that document. So that makes sense, but it is a requirement in HITRUST, and you have to be able to prove that you're actually doing that. And then the third level, the third tier for an even larger organization is that you have to ensure that all personnel who are assigned responsibilities as a matter of that program are competent to perform that work, and that you have to perform internal audits against that program. So you can see the increasing level of difficulty it is to comply with these things depending on how large your organization is. Jumping back to the first part of the question about the different phases. So if your ultimate goal is to get HITRUST certified, there's 3 phases that we recommend that you go through. The first one is a readiness assessment or a gap analysis. Basically, you document what your current control environment looks like, match that up against the baseline of what HITRUST requires, and see, do you even meet the baseline requirements? And so a third-party assessor could assist you in identifying areas for improvement and the things that you need to actually get to that ultimate goal of certification. The next step that we recommend is a self-assessment. And under the self-assessment, you would utilize that HITRUST tool to document your information, and then you would do some manner of limited testing to make sure that those controls are actually in place. You can do that yourself, or you could hire a third party to assist you with that process as well. And then the final phase to go for certification is called a validated assessment. And so with a validated assessment, you complete all that information in the tool just like you would with a self-assessment. However, you have to, in this case, hire a third party to actually test your controls. And this is going to be much more extensive testing than what you would see in the self-assessment. That third-party assessor would submit the results of those tests to HITRUST. HITRUST would review the information, and based on your level of compliance with the requirements, determine if you've achieved certification or not. So you'll get a validated assessment regardless, and that just means that HITRUST has reviewed the information that they were provided. But if you meet the requirements to a sufficient level, which is a graded score, and it's all laid out, it's pretty transparent how they grade those things, then you can get certification. Certification lasts for 2 years. However, in the interim year, you have to have interim testing performed. So it's not the full-blown testing that goes along with the initial certification process, but it is limited testing that you have to prove that your controls are still in place.
Okay.
I'm thinking if you're administrator, you just need to quit your job.
That's an option, I guess.
Well, we don't want to scare you. The first year of putting in HITRUST, and I'll get into this deeper on the last question that we're going to cover, but the first year it takes more time from the organization. The assessor from then on takes it, and it's much more involved for the assessor than it is for the organization. You're just continuing to implement your controls. So I'll get into that a little bit more, but we don't want to scare you away from it.
Yeah. We're ready to kind of close up to 9:30, so we've got 3 more questions. Gina, do you see HITRUST being required in smaller settings like physician practices?
Actually, for about 6 or 8 months, HITRUST has been telling us that they have a version called HITRUST Lite that is in process of being designed, and smaller organizations are actually testing it. So it would be for physician practices, and wouldn't be surprised. I would watch my contracts with payers. I wouldn't be surprised that they start inserting it into contracts. You know, a lot of clients that we work with now didn't realize early on what that requirement meant, and so they waited too long or close to not having enough time to get it done. But I'll tell you what you can do if that is the case. So yes, we do see that that's probably coming down the pipe.
Scott, how do you know if you need to be HITRUST certified?
So really the only requirement that's out there for you to be HITRUST certified is if you're contractually obligated to do it. There's no regulatory requirement or anything like that that I'm aware of. It's just, does your third party require you in a contract to do it?
And final question, what do you need to do if a contract says you need to be HIPAA compliant or HITRUST certified?
Yeah, so we've talked a lot about HITRUST, and I want to go back to HIPAA for just a moment and say that if you know you need to be HIPAA compliant, you know for sure that you are. Because just doing that privacy notice is not the only thing you have to do. Just encrypting data is not the only thing you have to do. And we recommend for both HIPAA and HITRUST a very similar process. Scott mentioned doing a readiness review. So for HIPAA, we suggest a readiness review. If you've never done a HIPAA risk analysis, the risk analysis is the requirement to be compliant. You have to perform it every year. And that's what would be asked for and would start an audit if you were to be audited by regulators. So the HIPAA risk assessment itself has all these security and privacy requirements. As Tanya spoke about earlier, some of them are addressable, many of them are required, and you very rarely are going to have something that's going to be not applicable. So that readiness review, we would come in and we would go through each one of those requirements and see what you have in place to address it. We would test that. We would see if it's working. If you don't have anything in place, that's a gap, and we try to tell you and work with you on how to fill that gap. What do you need to do to fix it? And then you want to take a time frame in between the completion of the readiness review and the next step, which is actually doing the HIPAA risk analysis, is to just take the time to fix things and get them in order and make sure that all your policies and procedures are current and where they should be. That's a lot of what we see right now, is that policies and procedures aren't documented. And in either one of these instances, you're going to need to have documented, current, and dynamic to some point policies and procedures. So in the HIPAA risk analysis, a lot of times our clients really don't want to do the initial risk analysis without saying, well, you go back and check and see if I covered all those gaps. So we might do a remediation project before we do the risk analysis. But then when we go into the risk analysis, we're going to document everything. We're going to test it thoroughly, test it for a 12-month period, and we'll have all the supporting documentation behind a deliverable that we would give you as a report, which is the actual risk analysis document that would be provided to anyone who asks for it, particularly regulators if they were to come in. And if they want to audit that per se, we keep the documentation, and they are able to look at that documentation and support. That has to be done every 12 months. And then for HITRUST, it's very similar. And you ask, how long does that take? Well, for HIPAA, it probably takes a good 12 to 18 months to go through that process if you go through those phases. HITRUST is about the same, but it might take more like 24 months. And so if you see a contract, like we had a client come to us in, I guess it was late 2016. Time flies when you're having fun. And they had a requirement in their contract that said they had to be HITRUST, I don't know if it said certified or validated, by January 1st, 2018. So we had to back into the process of the readiness They didn't do a self-assessment, and they ended up working with their the payer that required this. We developed a timeline for them. And you can do this with HIPAA as well. You develop a timeline of those phases and pieces and process to get you to the actual certification. If you have that, that's a good faith effort, and they're going to obviously be checking on you to see if you're staying online with that timeline, but that usually will help to, you know, stave them off for a little while. However, what we did do for this client is we were able to do, they're a third party, and they have software application systems that the payers use with their physicians and starting to use with patients. But they actually did, what HITRUST has is required elements. So certain required elements that you have to meet at a certain level to get certified. And so the first time through, they did the System and Organization Control 2 engagement plus HITRUST. So it's a SOC 2 plus HITRUST. And that HITRUST piece, so what you have is in a SOC 2, you have certain principles and criteria that you have to meet. You have certain controls in place, we test them, etc. Well, HITRUST overlaps that. Like I said, the Gantt chart, it overlaps with a lot of different things, and it overlaps with these AICPA SOC attestation standards. And so we could test a lot of the things for the SOC 2 covered HITRUST. But you always start with HITRUST because HITRUST requirements are more in depth. And so you do that and you address your SOC requirements. You still have some things you have to do for SOC that's not covered by HITRUST, and you still have some things that are required by HITRUST that aren't by SOC. But that's the most efficient way for a third party that needs to do both to do it. If you're just doing the HITRUST certification, you know, you do that layered process where you do a readiness review, as Scott mentioned. They actually, HITRUST has in their tool that self-assessment process. You can do that by yourself, or you can include the assessor. You know, we suggest that you get the assessor involved early on because they can help you lay out that timeline, they can help you with the readiness assessment, and they can help you with answering those questions in the self-assessment, which basically sets how many requirements and controls you're going to have to test to be certified. And then you want to get all those in place before you try to go through that validation and certification process. There's a very strict timeline itself for HITRUST when we start as the assessor providing information to HITRUST about the requirements and controls that you have in place. We have a certain amount of days to complete that. Then you'll have you know, exceptions, which they call corrective action plans, and you'll have a certain amount of days to provide that back to them with what your responses are. And then you're going to have to keep that up. It's a dynamic process. You have to keep addressing those things, and then that interim testing occurs. But the certification itself, getting to that point, can take anywhere from probably 18 to 30 months. That's why that timeline is very important, because if they put a deadline in there and you know you're not going to be able to meet it, when you start sitting down and you back into that deadline and there's just not enough time to get everything done, then you have to start saying, this is what we can do. We can't meet that deadline, but this is what we'll have done by that time frame, and this is what we'll do to get to the certification.
Well, I know we're just running a little bit over, so I want to say thank you to our panel. Thank you to all of our guests who have come. I think if you've got questions, we can stick around a little bit afterwards and answer those, unless there's something that's pressing. Okay. Gina, Scott, and
Thank you.
Thank you. And thank you guys again for coming. Just a little plug. Our next Healthcare Helpings is going to be Practice Management Best Practices. This is going to be on Thursday, March 29th, so feel free to RSVP. And thank you. Have a great day.